COVID-19 had overwhelming impact since it was first detected in late 2019. Malaysia recorded 45,199 new positive cases with 1,657 deaths since 8 May 2021. The COVID-19 or RO or RT contagion rates on an expected daily cases basis on 8 May 2021 for the whole country is 1.14. What is the impact of COVID-19 on Malaysian economy? First, tourism sector. Second, deterioration of Malaysian national trade flow. Based on figure 1, there is a step fall in the number of tourist arrivals in Malaysia. Tourism sector is expected to be hit the hardest. It will lower the gross domestic product as fewer goods and services can be produced in the country. In 2020, the total number of tourist arrivals in Malaysia is 4.33 million compared to in 2019 is 26.10 million. If the number of tourists continuously decreases, some of the tourism will be forced to shut down due to unbearable losses and unable to pay the workers' salaries. The trading sector also suffered a negative impact as a result of the COVID-19 trigger. According to Malaysia External Trade Development Corporation, Malaysia has recorded a total trade of 133.34 billion in April 2020, a decrease of 27.26 billion compared to the total trade in April 2019, which recorded 160.60 billion. Right now, we have to focus on flattening on the curve as much as we can, but very soon, we must shift our focus to how we flatten it for a sustained period without destroying major part of the economy in the process. First, change the social distancing paradigm. Second, change the operating model. And then lastly is increase communications dramatically. The new normal, it requires new practice such as hand washing, wear a mask and maintain at least 1 meter distance from others. With careful epidemiological analysis and modern analytical techniques, we should be able to create risk stratification methodologies to allow lower risk individuals to get back to work while responsibly decreasing the risk to themselves and society. This strategy will not be easy to implement, but it was an essential part of restarting the economy without revving up the infection curve beyond health system capacity. Next, change the operating model. We have to accelerate the use of digital and mobile technologies to make remote work and other activities easier. Beyond the urgent need for greatly expanded testing, we must begin taking temperature before individuals enter a school or place of work and go to public space. We should use artificial intelligence to notify at-risk individuals to self-quarantine so that we avoid outbreaks while respecting personal privacy. Next, increase communication dramatically. People need clear communication about what it means to work safely, such as follow the SOP, as well as how to engage in more careful social interaction. While we are focusing on the unprecedented and acute situation in front of us, we need to start thinking about how we will economically navigate the critical phase that follows the surge of cases we are about to get, as well as how to accelerate progress to our end game. Using a MySejahtera platform, it provides the latest location-specific updates on the outbreak, including numbers of affected people, deaths, affected countries, and other related data.